Okay, I have a reference from many texts from kinetic rehabilitation and from amputation and limb deficiency. Today I will talking about the principle of child development. Do you know development? Do you know? Okay. And the growth. Do you know what is the difference between growth and development?
Yeah.
Okay, I will talking about it today. And developmental milestone is mean the time that the children have some development in her age or in those ages. And the clinical application for you, orthopedic prosthesis. Okay. Before I start, I will show you about it. Do you think this is a normal development? Do you think it's normal development? Can you guess each child is what is how many age? Can you play this number? Okay. And this is cute. Okay. First, I will talking about the definition of the growth and development. The growth rate is some kind of a physical science, and I mentioned that relatively to maturity, such as your height. Do you know your height? How many? How much?
170.
Okay, 172 centimeters. Okay, it's mean of height, and the weight is measured as a kilogram for the patient. Kilogram. Weight is a body weight. Okay. Growth is mean only the physical change of the body. It's a parameter that you can measure it by weight or height. But the development is not only the physical, it means overall performance or overall maturation of the patient. Sometimes such as walking, crawling, pins, grabs, or talking and playing is mean overall performance of the patient. Development is mean the maturation of the organ or system that acquisition to the physical, intellectuals. Intellectual is some kind of pincer or writing. And interpersonal skills such as I talk with you or laughing, okay, do you know it? It's also ability to adaptation to stress or personal responsibilities. The development did you see the picture is increase in complexity or ซับซ้อน in Thai. Complexity simple to more complicated. Such as crawling in only first year of life, and walking, standing and running is more complexity for the progression of the times, or progression of the growth of the patient. Okay, the first is growth that I refer to is increase in the physical growth is parameters such as height, and measured by centimeters, and weight. that you can measure in a kilogram or gram for the infant. Infant is measured in only grams. Okay, and it can serial monitoring for your patient. And have you ever seen this picture? Do you know it? It's a picture is shown growth curve. It's a growth curve for the Thai infant. You can find in the OPD Sisangwan first floor. Is or in the OPD card on the outpatient card of the child. You can see in the outpatient patient card. Is a growth curve for the Thai infant is by age of 19 years old. The growth chart are used to compare the children's height and weight to a standard range of Thai people. That you can measure that this patient is overweight or underweight. Okay, do you know it? And it is critical for a child growth to be plotted on the age and gender appropriate. The blue chart is for boys and the pink is for girls. And we use it routinely in my clinic, in my OPD rehabilitation. Okay. Not only the growth is you can measure by your height. For the patient, such as the patient who cannot ambulator, such as the patient with CP who cannot ambulate, who cannot walk, or the patient with spinal bifida or paraplegia that cannot walk. This is difficult to measure the height. He cannot stand it. You can have the option to measure it by arm span. The arm span is a measure to provide indirect control parameter for measure the standard height. For the patient who cannot walk, who cannot stand it, such as in the patient that I talk about, it is for the patient who cannot stand it, such as spinal bifida, CP, or patient in a wheelchair. Do you know wheelchair? Okay. The arm span can measure to recommend to measure instead of height for those patients. You can measure arm span by simply raise the arm in a horizontal position, same as the pictures. And you can measure by the distance between the tip of middle finger or middle finger, left and right, measure by the tape measurement. Okay. The standing height is about 97% of arm span. So it's equal. I think you can measure this option or instead of height, especially the patient that I'm talking about it. Okay. And also the patient who have a spinal deformity. Do you know spinal deformity? It's some kind of scoliosis or kyphosis. This patient arm span is also a good estimate of what standing height would be if there were have a abnormal curve of the spine. It's option parameters. Okay. From development, that I talking about it. Development is I refer to the maturation organ and system that more complexity, as I showed it. Complexity, increased complexity, and simple for more complicated, such as prone for 3 years. Prone, and the child can rolling is pickup, and sitting for around 6 months. Sitting around 6 months. Do you have a baby? No. Okay. And standing with support, and the standing alone is for 1 year and 2 years to walk and run. Okay, it's more complexity for progression of the times. And the technique is very important because she is a children, not a small adult. Children is not equal to small adult. You know, the children has a very important you need to establish a relationship with the child before you performing to examine. This can be achieved by you can play with the child and talking to the child in a comfortable and relaxed. And the young children often are best examine while his and her sitting on a parent lap. And the examiner can carefully observe the child every movement and interaction. It's very important. I think you not to force to examine. You need to create a relaxed environment. Relax. Okay. If the patient are preterm, do you know preterm infant? Do you know it? Do you know it? No or yes? Yes or no? No. Okay. Preterm that means term infant is about 38 months old of the patient of the infant in the mother. In pregnancy is about 38 months. Gestational age means gestational age and delivery at 38 months. Sorry, 38 weeks. 38. Okay, 38 weeks. Sorry. 38 weeks is normal of 40 weeks in pregnancy. It means the pregnancy. If the child or infant need to deliver before, such as 20 weeks, he needs to some kind of have a disease to operation or some kind of operation or cesarean section or delivery before the 38 weeks. It means preterm infant. You know it. คือคลอดก่อนกำหนดภาษาไทยนะ Okay. Before the expected weeks of the gestational, it means preterm. Some kind of patient have a preterm for if he deliver at 30 weeks, it means before normal 8 weeks. Do you know it? Or preterm for 2 months. Before it means deliver before the 38. Deliver 2 months before the normal period. It means if you want if you find you know that the patient is preterm infant, you should to correct the age for developmental assessment, such as the patient have preterm 2 months, and now he is 1 year old. Now he is 1 year old after birth. Okay. Now he is 1 year old after birth. The normal development that you assess is about 10 months. It means 1 year minus 2 months that he is delivered before preterm 2 months. Is you understand it? Okay. Okay. If you have a patient at preterm 2 months, normal is preterm 2 months. Deliver before the 38 weeks or 9 months. But the pregnancy is about 9 months. Okay. 9 months. Okay. If he at 7 months he is delivered. Okay, and but now his age is about 1 year. Now his age is 1 year, but development he can only 1 year minus 2. The now his development assessment is about 10 months, not 1 year. Okay, do you understand it? เอาภาษาไทยนิดนึงหมายความว่า in Thai when we for Thai people สมมติเด็กคลอดกับกำหนด2 เดือนนะคะตอนนี้เขาอายุ1 ขวบเพราะฉะนั้นพัฒนาการตอนนี้เขาก็จะแค่ประมาณ10 เดือนโอเค for foreigner student do you understand or not okay
Is there any duration between?
Preterm is mean the patient or the patient who deliver or birth before the expected period of time. Okay.
You are at the 2 weeks earlier.
Yeah.
Is not preterm, right?
If the patient have a preterm 2 months or 2 weeks. 2 weeks, you can minus 2 weeks with the normal age of development. Development age is normal age minus the duration of the preterm. Yeah.
When the patient, that person get delivered on the 38 months, we can say 1 year development.
38 months. This is normal. Normal is term, is expected period. Yes. If he is delivered at 30 weeks, it means he need to minus 8 weeks for his age. Okay, for assess the development. Okay.
Only the development is 10 months.
Yeah. Yes. And you can ask the physician about the expected or corrected age because it's sometimes difficult if you don't because it's in the medical record on the OPD card. You can ask your physician for this information.
For a child who is born prematurely, and does the age effect on the vaccination? Does the age effect depend on the vaccination?
The vaccination is I think is for the pediatric to assess the child for vaccination. Not me and not you. I think it is the role of pediatricians to assess this because I think for you it's only a developmental assessment.
For general knowledge, I am asking. For a baby who is born prematurely, say for example 2 months premature.
Can you speak louder, please? Sorry, can you stand up, please? I don't understand. Okay.